enteroviral meningitis, spirochetal, helminthus, Lyme. We'll talk about pathogenesis and some of the clinical manifestation, and then we'll finish with chronic meningitis, primarily syphilis, TB, and fungal infection. Okay? That's the story for today. And again, I want to thank you at the beginning for attending. Attending shows two things. Number one, you're here for the show, for the interaction, makes your life easy. You are able to go through the slides much easier. هاي رقم واحد. ورقم اثنين, شو بصير؟ You discipline yourself to become a successful doctor. It's a discipline. عايش السلام. تفضل. الأخرة. So it's a discipline. If you don't have the discipline to wake up early and attend your talks, and attend your clinic, and attend your hospital, and attend to whatever it is you have, تمام? Then you have a big problem. Big problem. Okay? If someone is pushing you to become a doctor, don't be a doctor يا عمي. Go follow your passion. ممكن أنت رسام ولا خياط ولا ما لهم خياطين. ابدعوا صيروا واحد خياطة ممتازة. كل اللي تيجي تخيط عندك مثلا. Okay? So you don't have to be a doctor. If you don't have the passion, go follow your passion. أما نيجي نجركم وعملات تنزل صغار، أنا بستحي عملات تنزل. بستحي. بس today ما في حدا دار. I have to let me obligate it. ليش تدخل؟ ها؟ والله ما أسمع. الحمد لله على السلامة. So that's the story, yeah? So we start with the terms of acute and subacute meningitis, and the less than 5 days and more than 5 days. So subacute meningitis and acute meningitis with few white blood cells in the CSF, okay? So that's the definitions that we will familiarize ourselves with, and then the etiology. Last week we said the most common cause of acute bacterial meningitis is true. Virus. So, and I did give you an assignment was aseptic meningitis syndrome. شو aseptic meningitis syndrome؟ شو هو definition? Define it يعني هو مكتوب. بس you've looked it up صح؟ والله موجود الكلام. Not الكلام. Thank you for being honest. شو definition? Negative CSF or blood culture. Okay? تمام. So what are the most common viruses؟ رح تنسالوا على aseptic meningitis syndrome، واللي بعد كده بحكي لكم عنه رح تنسالوا عنه، لا تحكي لهم غايبين، خليكم شطورين، لا تحكوا لهم. Take it on it. It's fair. مش انتوا جايين يداوموا، مش هم مش راضيين يداوموا. It's fair انه انت تعرف لحالك صح؟ اللي ما بده ياخذ العلم وما بده يتعلم، خليه عند اهله، احسن له. والله. هسه بتلاقي امه قاعده بتعجن، هسه بتخبز له، بتطلع له الخبز الصافي مش هيك؟ هيك الأردن كلها بتعجن، محاش بيشتري المخابز أصلاً. Enteroviruses are the most common cause. Enteroviruses are the most common cause. Kawasaki A6 and the HPV type 3 are among the most common cause. At 48 to 95% of the time, it is an enterovirus. شو البرزنتيشن؟ severe headache with no corrigibility تعبان ما بعرف شو ماله وشوية حرارة. يوم الثاني ولا منيح خلاص self limiting. Just like a flu. مش هيك؟ احنا do we treat flu? We don't. تمام؟ Similarly here, self-limiting. What's interesting about entero, in addition to that, airborne is also fecal-oral route. ولما تشوفوا الامتحان schools, crowded students هيك then think of enterovirus.
ما في هيك sessions
في ملل. بس primarily بتكون fever وheadache وهيك. Sudden without any other يعني without any introductions خلينا نقول. بلش هيك fever وheadache ما راح يموت. شايف كيف؟ So this is entero, okay? Most common cause, and it is self-limiting. And thereby we coined the HCV2, herpes simplex virus. We coined it with moderate. اللي هو an old term now, it's called recurrent benign lymphocytic meningitis. Moderate. ما راح تسأل عن moderate, okay? طيب, so that's moderate, and and this is the association. So what causes Mulleret? HSV2. All right? And then I can say Mulleret on the exam, or I can give you the new name for Mulleret, and you should know and you should answer correctly. هذا easy شيء، في شيء حفظ. ما حقيقة يعني little things to memorize. It's the interaction, how we connect, and then you just go home, look up some videos, look up some YouTubes, and then you're good to go. As simple as that. Okay? Zoster, sign heavy without a what? Without that. شو بنسميه؟ فرسيل زوستر ليجن. شو اسمه؟ شو اسمه بالانجليزي؟ Shingles.
shingles.
Right. CMV with EBV, cytomegalovirus with Epstein-Barr virus, they do cause meningitis, بس الكي او التريك تبعهم انه mononucleosis like syndrome. السلام عليكم الله، ليش بنخرج؟ ممتاز، سجلنا فيها تمام، والله سجل اسمي. So mononucleosis like syndrome، شو المونونيوكليوسيس؟ شو هو؟ lymph node involvement, fever, hepatosplenomegaly, مش هيك؟ Caused by what? ما بنعرفش. You look it up on your own، ماشي؟ Enjoy it, have fun with it. Look up mononucleosis syndrome. لما يجيني mononucleosis like syndrome، ها شو؟
EBV مش هيك ابستين بار فيروس.
بيعمل mononucleosis؟ طيب ممتاز. Okay? But if we have mononucleosis like symptoms with the meningeal involvement اللي هن احنا بنعرفها، الفيبر، ميكروجيلتي، مش هيك؟ photophobia, then most likely CMV or Epstein-Barr virus. مين حل حسين فواد؟ ليش كانت اسمك موجودة؟ طيب بتسوي خلاص. مريم؟
أنا.
سجلت اسم حدا؟ طيب. So, moving from that, we move to the arboviruses. Your job with the arboviruses is a simple exposure to the slide. I'm بفرجيكم in the slide some weird names that only occur in the northern Americas, where it is either a mosquito-borne or a tick-borne disease. Now that you know it, you should be easily able to answer St. Louis or California encephalitis or possum or cubitus in case of tick-borne disease. The only idea of this slide is that there is an arthropod transmitted بالعادة بتكون arbovirus. هاي الستوري بس. Okay? If there is a mosquito, tick, or a sandfly in the question, هاي رقم واحد. رقم اثنين عم يعطيني meningitis like presentation. Okay? And then I'm referring to St. Louis. Happened in St. Louis. The most likely is this slide. For example. Then I come mosquito. Okay? But the idea of the slide here is very uncommon in Jordan, but it's important for the board exams, and that's why we're showing it to you. Okay? Just read through. The last line is important. ليش? It's important for everything. Age, gender, pre-existing conditions dictates your robustness of your immune system. صح ولا لا? The more the robust the immune system, the more the ability if you're able to clear the infection more readily and robustly, and thereby age, gender, and predisposing conditions remain to be true. طيب. Lymphocytic choriomeningitis virus. ليش عم نفرجيك اياه؟ Rare. Very rare. Okay? But this thing with the LCMV اللي هو rodent exposure. تمام؟ Whether it's a pet owner or laboratory technician اللي بيشتغلوا على الفئران تجارب يعني. Okay? Or someone who lives in a poor sanitation like Paris where it's infested with rats and mice, for example. Right? So if that's the case, then most likely if I give you issue له علاقة بالفئران or hamsters, then I give you a meningitis-like picture, then most likely the common cause in this case is that CMV. It's not EV or CMV, okay? Or high trick taker. This is the idea. Mumps. شو يعني mumps بالعربي؟ النكاف أبو ضغين. تمام. So we're all familiar with the picture of mumps, right? Start with the salivary gland, مش هيك, or parotid gland, and and if untreated will end up with orchitis or oophoritis مش هيك؟ شو يعني orchitis and oophoritis؟ inflammation of what؟ ها؟
middle ear.
oophoritis middle ear؟ أنا قلت orchitis and oophoritis شو هذول؟ طيب in this than 1% of the cases طب ليش فرجنا يا دكتور؟ لأنه I have to show you I have to let you know that mum can cause meningitis in a very low frequency. Nevertheless إذا بجيب لك السؤال someone with inflamed or swollen unable to eat مثلا and painful chewing مثلا زي هيك okay for the past few days and all of a sudden then he developed a headache fever and urgently then you know most likely we're talking about meningitis of a mum etiology واضح that's the story meningitis of mum etiology but mum itself if untreated the natural history of the disease without the modern intervention of medicine بيؤدي لأوركايتس and oophoritis عقم يعني. هو المام فيروس. بسألك however I want it بس احنا الidea we are informing you that mums can cause meningitis. فإذا clinical picture comes as mums with meningitis like بعطيك a list of viruses to choose from then you should be able to choose the one that is mumps مش هيك؟ HIV similarly. هلا HIV زي ما بتعرفوا it escapes in the CD4 and CD8 cells in the immune system and it causes a wide range of clinical scenarios مش هيك؟ Why am I showing you on this slide? I'm showing you for one reason and one reason only. تحكوش للي غايبين رح اسألكم على ايش؟ على CSF viral escape. This phenomena سبحان الله انه بتلاقي in the CSF the virus without the ability to detect or a very low level of viremia. Okay? Viremia. يعني virus in the blood. Okay? The viremia. One more time. والله على راسك. مرت زي هيك دوام تشتري بنت مش بمان someone else. عباخذ نقطة. قال لي ليش على التليفون يا دكتور ما مسلم؟ أنا آسف. A viral escape is an important phenomenon that we ought to familiarize ourselves with when it comes to HIV. Okay? That's the only reason why I'm showing you this. Zika, Dengue, Ebola, again, these are systemic viruses that do not target the CNS primarily in West Africa. However, when that happens, it is possible, it's not unlikely. It is likely, okay? That's all I'm saying. Okay? Zika and Brazil. جينا على الفيلم مقالة. فيلم مقالة ده أخذتوه أنتوا صح؟ درستوا سفلس؟ درستوا برايمري سكندري تيرشري سفلس؟ يس أو نو؟ حلو نو. تروحوا على البيت زي الشطورين تدرسوا برايمري سفلس، سكندري سفلس وتيرشري سفلس. You need to study it on your own. وتعرفوا what is it, what are the manifestation, and what are the difference between primary, secondary, tertiary. For the exam, there are two pieces of information راح أحكيكم عليها عن السفلس. Number one, the virus gets to the CNS early on, يعني during the initial phase, it gets there, but it doesn't cause manifestations. يعني the clinical manifestations happen in secondary and tertiary later on. Peak after 7 years. 2 years, even after 7 years, that's the peak incidence of meningovascular syphilis. طيب. Syphilis on meningismus, Ushiga, and some cranial nerves of open. What are these cranial nerves? Shua, facial, vestibulo-cardiac. Okay? Like, the story of syphilis, or the fame of syphilis, disappeared after the era of discovering penicillin. We don't see syphilis as much after penicillin killed trypanosome, ولا syphilis كان كثير منتشر. كمان كثير. مين الفيمس كاركتر الهيستوري اللي كان عنده سفلس؟ ادفانس تيرشري سفلس، كان مهوي. مين قتل كثير ناس بالحرب العالمية الثانية؟
Hitler.
Yes. And the story says انه he syphilis and it got through the natural history of syphilis. And ما كان في modern medicine intervention. That's what we say natural history of things in medicine. And then he ended up with manifestation of tertiary syphilis, including spinal pains. أحفظ آخر slide. Remember it, أنا راح نسأل عنها. آخر slide, last slide. So anyways, so that's syphilis for you. The interesting thing about syphilis, as I said, the virus gets into the CNS early on, the early stage, but it doesn't cause manifestation illa later on. 2 years or peak at 7 years. ممكن أسأله as simple as that. 1, 2, 3, 4, 5, 7. Answer 7, that's it. Okay? Lyme disease. Lyme is a deer tick-borne disease. مع الغزلان لما كان عندنا غزلان. هلا هذا Northern American disease. اسمه neuroprognosis caused by Borrelia burgdorferi. Okay? Disseminates into the CNS early on in the infection. 2 things to remember about Lyme disease. غير الاسم انه في شيء اسمه erythema migrans skin manifestation وفي ايش؟ the clinical picture. clinical picture لواحد صياد عنده depression عنده emotional liability he's forgetful تمام؟ مهوي with a gun تخيل الله يقول لك رعاة صياد مهوي صياد غزلان دير تيك بورن يعني كولورادو نورث كارولاينا ولا دير منتشر هسه everywhere بس يعني بنحكي انه تيك بورن ديزيز مع الدير normally hunters will look at the clinical image illness, emotional liability, depression, impaired memory and concentration and behavioral problems. So if someone comes into the question like that, I'm trying to follow the clinical ضليت بالأردن. Again for your career trajectory, think about what is it that you want to do in 3 years from now. And one, you should have plan A, plan B, and plan C. Yeah, like inshallah. So someone with this clinical picture and erythema migrans, I would think of neuroborreliosis, Borrelia burgdorferi, that's Lyme disease. اوكي اميبا اشهر واحد فيهم النيجليريا. اذا انا راح اسالكم عن النيجليريا شو الاسوشيشن؟ The association is something associated with water, okay? So water associated activity near the water in a swimming tank or a pool. يعني لما اقول لك نفض الغسان كيف الغسان مي نظفه مثلا غسان مش محسوبه. Then what do we need? We need increased insertion water into the nasal cavity. We need a sport or a force to rush the water in. يعني تكون براس بالمخ مثلا. تمام؟ So water skiing is one of these activities to get the water in, including the amoeba Naegleria, and Naegleria then establishes that disease. A disease, what's interesting about PAM in this case? So on PAM, اللي هو parameningoing virus, okay? So not only the meninges, but also the brain matter get infected. So PAM, water-associated activity, okay? And then bitemporal or bifrontal headache. These 3, 1, 2, or all 3 come in the same question. You answer amoeba. على الأغلب Naegleria حطوا بالامتحان. ماشي؟ واضح الكلينيكال بيكتشر of how Naegleria can cause PAM. Primary meningoencephalitis. Good. Nematodes, Angiospergillus cantonensis, nematode. Nematode 3 things. أول شيء الأكل والجيوغرافي والصور. الأكل اللي associated with getting this nematode اللي هو أكل مش مطبوخ بالعادة يكون زي snails أو slugs. Prams يعني shrimp, crabs, ضفادع كلمة كوية، ديدان آخر واحد معناها ديدان، وين راح؟ هاي الأنترية هاي الدود الكبيرة. سواء مان versus wild. بقول لك أكل الدود ولا ما أكلش دود؟ بس أكل الدود شو هذا الشغل؟ طيب. So the distribution will remain in Asia and some Pacific and Hawaii as well. And normally ship to ship or port to port. شو port to port؟ يعني واحد بيكون on a cruise honeymoon أو قابل مرته رايح على كروز لحاله for example أو هي قابل جوزها رايح على كروز لحاله عشان نكون يعني عادلين. تمام؟ So the cruise ship stops at different ports, for 5 or 6 hours at a time, and thereby you go in there, you mix with the endogenous, and you eat their food, and then you leave with the present. The present شو يسموها؟ nematode meningitis, and the symptoms are meningitis. So these are the 3 things that you would want to memorize about nematode and meningitis. Now, the story of pathogenesis, the molecular pathogenesis of a viral infection. Do viruses have a port of entry? Do viruses have a port of entry to the CNS directly? لا. The normal either inhaled or ingested, either respiratory or the GI system. بشكل عام شيء. So if they are able to escape the gastric acids and the bile salt, and able to escape the upper respiratory tract and the lower respiratory tract defenses and establish the infection, so adhere, colonize, multiply, and then, and only then, disseminates. Dissemination to other comes at the end, and that's the story of all viruses. So this is pathophysiology. Start establishing the disease, crossing the blood-brain barrier. Pilus patches is one. سامعين pilus patches ماشي؟ تعرفوا شو هي؟ Pilus patches. These are all the lymph nodes that the blood can establish and grow and flourish before it starts, including pilus patches in the intestine. سامعين pilus patches ماشي؟ اسمع فيها on your own. دخل التونسس لا الانتستين. Other sides, pilus patches in the small intestine. Look it up all the way to disseminate to the vascular or reticular endothelial system. ومشان هيك حطينا slide dedicated for the mechanism of it. أول اثنين هم most common obviously اللي هم you would expect, crossing the blood-brain barrier and establish that infection. Now the last 3, okay, well it can go through the cerebral epithelium or through a choroid plexus epithelium or through the peripheral nerve entry. يعني مع peripheral nerves, throughout all the peripheral nerves. Okay? So these are the 5 mechanisms that I want you to familiarize yourself with. Okay? سهل صح؟ So directly crossing cerebral capillary. In fact, the microvasculature carried between cerebral endothelium and leukocytes. يسمينا هذا leukocyte business. Through the leukocyte شو اسمه؟ Trojan. Back to HSV2, and it causes recurrent benign lymphocytic meningitis, okay? Encephalitis, that's this case. Okay, and then we talk about the mononucleosis-like syndrome. I don't know what it is. This is what it is, okay? For cytomegalo and varicella-zoster, you're not going to talk about rash, pharyngitis, hepatosymphenomegaly, as well as lymphadenopathy. West Nile, chronic fatigue after years. I'm showing it to you just to let you know that it can cause meningitis, and then we are looking at the mump presentation. Okay? So the mump presentation, normally with fever around the head to be the most common presentation, including and not excluding. If I exclude it, I will do you the service بصراحة. نقول سؤال صعب. I have to do it. الهند بتكون سهلة أنا قلت بيان صح ولا لا؟ That's natural history of the disease, bolian and death without harm, medicine, and intervention. And that's it. أعطينا لكم assignment شو يعني إيش؟ Look up and find out what is orchitis and oophoritis that leads to sterility. Inability to give pleocytosis, RT-PCR. شوف بشكل عام whether it's RT-PCR. شو RT-PCR؟ reverse transcriptase. ليش يعني reverse transcriptase دكتور؟ احنا what are the 2 big families of viruses؟ DNA viruses. نعملهم PCR صح؟ Now we all agree molecular mechanisms for diagnosis of a viral infection is PCR, molecular diagnostic. Normally it's the better way or the best approach, تمام? So molecular diagnostic techniques such as PCR. PCR from an RT, شو موضوع ال RT؟ reverse transcriptase PCR. شو الادفانتج اللي بيعطيني اياها؟ better outcome, cheaper, cost effective, duration, شيء كله very nice, lovely material مالك تستفيدوا منها. RT-PCR هذا من مانديل تبع حكي كله مش مبالغ فيه. تعرفوا مانديل؟ حاج مانديل الله يبارك فيه. مانديل. So شو الRT؟ لأنه RNA viruses مش هيك؟ RNA viruses we need to do a reverse transcriptase before we are able to
لما PCR
do the PCR. أحسنتي بارك الله فيكي. RNA does not work in the PCR. بدك تعمل RNA شو؟ cDNA. نعمل cDNA. إذا الكلام اللي بحكيه سحر look it up. اكتبوا RNA cDNA RT-PCR تفهموا لحالك. وشو الفرق بين الDNA والRNA؟ sugar. وريموف الشوجر بصير DNA. chronic meningitis all the way to MRI and other diagnostic tools. بس شوفوا بشكل عام molecular diagnostic techniques are normally the most likely correct answer على الجسم. So these are the other stuff that causes chronic meningitis مثل fungi, مثل TB, مثل syphilis. And this is the cerebrospinal fluid tests, serum tests that are involved. كثير صح؟ بس whenever we see an antigen, antibody, PCR, normally that's the one we look. Coccidioides evidence is in southern Arizona, New Mexico, the Jaffa H4H5. This is spore in high temperature survives and puts in air. بالعادة occupational hazard for soldiers مثلا على military bases مناطق صحراوية. They inhale it, it goes to the lungs and they recover. In some instances, it can cross the blood-brain barrier and establish the infection. Eosinophilia is what is unique and characteristic when it comes to fungal and especially eosinophilic meningitis with helminth infection. So, antibody test or surgical test is important. Okay, coccidioides meningitis, histoplasma. الهستوبلازما بنشوفها كابسولارا in caves. مستكشفين camps, campers, they go into caves, they're exposed to the bat, and the fish dropping. It's a nitrogen-rich soil or bat dropping filled with histoplasma, and they get the disease. The disease is respiratory disease with respiratory manifestation. مش ماخذين histoplasma تاخذوه ان شاء الله. I'll look it up if you don't take histoplasma as a disease. But هون أنا بس بفرجيكم it also cause the meningitis. The MRI shows intracerebral granuloma and ring-enhancing lesion. هذا USMLE material, ring-enhancing lesion and granuloma.
Bats are like the most common method for transmitting disease, right? The most diseases come through bats.
مش بالضرورة بس يعني in this case yes. Some cannot generalize. Remember that we swim in an ocean of bugs. They are in us, on us, and everywhere. هلا في شيء crosses to us from plants, في شيء crosses to us from animals. Some do, some don't. ما تحكي على الميكولوجي world, thousands and thousands of fungi. كلهم toxic, كلهم bad? لا. Few selected thousands. And how do they cross to the human is the story. Perfect? That's a different topic. في species monogenic drifting and shifting. نحكي عنه بعد. Candida يا طويل الإعمار it exists in your body بشكل طبيعي. It is considered part of the normal oral, GI, and genitourinary microbiome. It only crosses and causes disease when the patient is about to die. Normally, an ICU admitted elderly or children, and the moment we see Candida in the blood, يعني Candidemia, نعرف إنه that's it.
Immune deficiency.
It's the end of the road. Write your will. بسيط. But normally, any catheter associated in dwelling devices, someone really debilitated, really heavily burned and bombarded, their immune system is really weakened. Okay, and whenever you see candle in the blood, خلاص يعرفوا انه it's the end of the line, it's the end of the story for that subject. And I would try to give them antifungal which is normally that. So, let alone meningitis crossing the blood-brain barrier, that's a problem. طيب, Sporothrix, the lover's disease, in which you need the traumatic introduction of the spore into the subdermal space. بعد السبديرم بعطيك lesion in your finger. It's a rose garden disease بصراحة. أو lover's disease. اللي بلغت الورد، والورد في عليه شوك. لابد هدول الأشياء دي نعتبرها نحن شيء الشاعر بيقول. تمام. So it gets in there, and from there it gets to the lymph node. And from the lymph node, it's possible for someone immune compromised or more susceptible to cause disease. So that's sporothrix meningitis. Blastomyces emitens, Blastomyces dermatitis, skin involvement, can also cause disease. These are rare fungal diseases that we acquire, and I'm just showing to you to know that they also cause meningitis. نكمل ونخلص بالtuberculosis. Microbiology tuberculosis درستوها وبتعرفوها صح؟ So the question in the exam will be, what is the most common cause of chronic meningitis? الأنسر TB. The presentation of TB اللي انتم بتعرفوها. Hemoptysis, claws, night sweats, plus some meningeal manifestation. فإحنا بنعرف إنه we are dealing with chronic meningitis. تمام؟ طيب. What are the triggers that enhances your clinical suspicion when you are dealing with a patient of meningitis? مشان تعرف كيف تعالج صح ولا لا؟ طيب. Some of the triggers is high fever with rapid decline in consciousness, candid with immunotherapy to cause meningitis for 4 drug regimens. So someone with this, or some migrants from the countries where it's endemic in TB, India, Pakistan, Mexico, لكن أمريكا، تمام؟ or Latin America بشكل عام جاء على أمريكا US of A يعني. Patients with history of tuberculosis or household contact. هذول الناس testable for whether or not we should administer corticosteroids. ليش؟ لأن إذا كان fungal infection وأعطيت steroid أنت بتقوي fungal infection. بس إذا كان TB you need to give steroids to calm things down so you are able to give the TB regimen. So you have to be certain about your clinical suspicion, do a proper differential diagnosis and testing for whether or not you decide to give the empirical steroids for these patients. أنا زي ما قلت class empirical response. So آخر فقرة قرأوها وافهموها يمكن أسألكم عليها. آخر فقرة بالتي. And we all agree the most common cause of chronic meningitis is pallidum. I will give you pallidum. When لما كنت تتفرجوا على هتلر, if you've never seen Hitler, watch how he gives his speeches. You can see this lightning chains. مثل اللي عنده دسم عافانا الله وإياه. واحد عنده دسم. رجع زمان نكون ضغط بعدين نوصل لهتلر. ما كنتوا تشوفوا زي هيك؟ أنا ما لحقتوش ولا أنتوا لحقتوه بس في watch. Yeah? So that's lightning chain. And in history our theory بتقول إنه هتلر عنده إيش؟ عنده tertiary symptoms. Meningitis, pseudocytosis, elevated protein levels, and all of those things. It's different from the bacterial normal glucose level. Okay? What we're going about it, it's a bacteria, مش هيك؟ And it's considered a bacteria. Questions? Good?
So, you got it requires a force